Hello, and welcome to the Achieve Optimum Health Summit, where we explore how to prevent and reverse chronic illness. I'm Angelina Kardash, your summit host, and today my guest is Dr. Brooke Goldner. She's a board-certified medical doctor and the author of three best-selling books, Goodbye Lupus, Goodbye Autoimmune Disease, and Green Smoothie Recipes for Kickstart Your Healing and Health. She has been featured in multiple documentaries such as Eating Your Life, Whitewashed, and The Conspiracy Against Your Health. Dr. Goldner has been also featured on the front cover of the Vegan Health and Fitness magazine numerous times, including the recent issue Fit Over 40. She's a founder of veganmedicaldoctor.com, goodbyelupus.com, and the creator of the Hyper Nourishing Protocol for Lupus Recovery. Welcome, Dr. Goldner. I'm so excited to host you here today. I'm a huge fan of yours and absolutely love your personal story.
Oh, thank you so much.
So I know that you take a great pride and pleasure in educating audience on wellness and healthy lifestyle. That's why I'm super excited to talk to you about reversing autoimmune disease or any other disease with supermarket foods. So my first question to you is, why don't you tell us about yourself, your story of healing lupus, and your life mission?
Sure, of course. So as you already said when you introduced me, I'm a board certified medical doctor. But before I went into medicine with the white coat on, I was sitting on the other side. I was the patient, and I was patient for a very long time. I was diagnosed with lupus at 16. And at the time I had something called lupus nephritis. So I was already in kidney failure, at stage 4 kidney failure, actually. And at the time, my nephrologist told me that it was progressing so quickly that I would be on dialysis or even dead within 6 months if they didn't do something aggressive to get the disease under control. So here I was at 16, stage 4 kidney failure, rashes, migraines, arthritis. And, that was kind of my everyday life at that point. And, it was bad enough with the arthritis, but then with this looming over my head of how severe it was, we had to take aggressive action. So at the time, this is a while ago, they didn't have all of the fancy meds they use nowadays. Nowadays, there's Plaquenil and Benlysta and Cellcept and all these medicines that, well, they're super expensive, but don't actually change the outcome. I mean, over the past 30 years, there hasn't really been much change in outcomes for people, even though the expensive medicines are here. But back then we didn't have all those. And so it was high dose steroids, which I took. And they were just beginning to experiment with using chemotherapy for kidney failure. And the reason they use that is because chemotherapy, the side effect of chemotherapy, which is usually used for cancer, is it shuts down your immune system, which is why people with cancer often die of infections. But with lupus, it's an autoimmune disease, meaning that your own immune system is working against you. It's attacking you instead of protecting you. So their thought was, what if we use chemotherapy to shut the immune system off and then let it start up again, like rebooting your computer, and see if you do better once you reboot. So that's what we did, but they really weren't sure of the dosage and the timing. So I actually did chemotherapy for 2 years straight with the high dose steroids. So from 16 to 18, while I was finishing high school, I was getting monthly chemotherapy and taking 7 pills a day. And then whenever I wasn't too sick from puking on the chemo, I was just memorizing my textbooks. So that was really just, life was very much about survival back then. And I credit especially my mom. My mom is extremely, she's an amazing person that always kept me focused on, hey, it could always be worse. Listen, you just got to plan when you're going to study for your test because you got chemo this day, test this day. So she kept me focused on, like, one, I was going to finish high school. I was going to go to college. I didn't even know that was an option not to growing up. I thought that was just, you have to, right? So it was very much like your life's not stopping. This is just something you have to deal with. You have to schedule it, but it's not going to change the course of your life, which she was really an anchor for me. And then, my family's actually Holocaust survivors that immigrated here. So I'm first born in this country. And, growing up with the stories of my grandparents that survived the Holocaust, even being on chemotherapy was a vacation compared to what they lived. So I was blessed with a lot of really good perspective and some really tough family members who are like, you're going to get through it. You're going to do what you need to do, and you're going to live your life. Although they were tough to my face. But, you know, I could hear my mom cry at night in her room. And there was, when I was first diagnosed with the kidney failure, my grandmother cried for the only time I ever saw her cry her whole life. And she got on her knees and started begging God to take her life and spare mine. That was something I'll never forget. But, you know, I'll give away the ending. I'm still here. And I made it. But it was really, I mean, it changed everything. And so thankfully, one of the gifts I got was an extraordinary focus on happiness and gratitude, because being told you're going to die at 16, to me, that made me more obsessed with life and living and happiness, because who knows how much time they have, but we can all decide how we spend it and how we feel. And I was also obsessed with purpose. I wanted my life to matter and have meaning. So I thought one of the best things I could do would become a scientist or a doctor where I could help people. So however long I lived, I would be contributing to this world in some positive way. So that was really my life goal. And I actually finished my last chemo a week before I started college. I graduated in the top 10 of my class. I got a scholarship to Carnegie Mellon in spite of all I was going through. And I dove really hardcore into research. I did genetic research for 3 years, thinking maybe I'll come up with a cure for lupus. Turns out I hate doing research in the lab. The science, I love. Sitting in a lab for hours a day with test tubes, not my thing. I'm super social, love people, just wasn't for me. Decided to go to medical school. And really that's when my story I got sick again, because college, I could control my sleep schedule. I could control my stress levels. You know, it was a lot, you know, Carnegie Mellon's a challenging school, but I was able to do that successfully. Medical school, not the place to go if you need to get enough sleep and avoid stress. That was, that's just not. So I got sick again in medical school. I developed blood clots, started getting mini strokes. I collapsed in one of the clinics and found out that the lupus was now causing me to get these blood clots. So ended up back with my doctors, told I had to take blood thinners, injectable blood thinners every day for the rest of my life, or I could have a stroke. But if I hit my head on blood thinners, I could also have a bleeding stroke. I already knew after having the kidney failure, I was told that I could never have children. But then getting the blood clots, it was like, yeah, you're going to have a stroke. You can't do that. So there was a lot of limitations. Like I already knew from a young age that I wasn't going to live a long life. I couldn't have children, but I figured even if I become disabled, which they predicted by my 40s, I'd probably be disabled, I could still be a doctor from a wheelchair. But when I started having the mini strokes, that was really terrifying for me because, you know, I'm no athlete, but my brain was like all I was counting on. You know, I'm a nerd. That's what I'm good at. And the idea of possibly losing my brain because of a stroke was the scariest thing. But I ultimately came back to that place of gratitude that I live in, that I didn't die. I didn't have a major stroke. I did have a full recovery. I was going to graduate medical school and I was going to live that dream of being able to take care of people and help people. And that was really, you know, what my life was like through that. I mean, you know, I dealt with migraines, I dealt with pain, I took medicines for all of those things. If I went out in the sun, I would get a rash, or I'd get migraines, or I'd get arthritis. And that was just kind of part of life. And it was a part of life that I accepted, but it was never something that I ever thought I could eliminate. One, because my doctors had told me it was incurable since I was a kid. And two, because, listen, I'm a Western trained scientist and doctor. I've done genetic research. I've trained in medical school. You know, I was chief resident. You know, I'm supposed to know everything you need to know. And it was just not something I ever considered a possibility of going away. It was just something that I had accepted living with, and I didn't let it take my happy away. So that was really how I thought my life would be. But things changed just as I was graduating medical school. I met my husband, Thomas Tadlock, and he loved a sick girl, wanted to marry me, even though I couldn't have kids with him. I told him I was going to be disabled. He was going to have to take care of me. I wouldn't live a long life. Not exactly a turn on, you know, for a 28-year-old, like, hey, great deal. But he told me, you know, he'd rather have a short life with me than a lifetime with anyone else, and he would take care of me. So decided to get married. And that's what changed everything. People always ask me, all right, you know, this year I'm lupus free 15 years. And they'll say, how did you do it? How did you think of it? How did you discover it? No, I had no inkling. I wish I was such a brilliant genius that I thought this up. Nope. I fell in love. And my husband, who is he's a fat loss expert. He has a best-selling book on metabolism. He's a brilliant scientist from Carnegie Mellon, figured out that you can change people's metabolisms through diet. And so since he was going to marry me and I was going to actually wear a wedding dress, I asked him to put me on a diet to look good for our wedding. And we had to make some changes to his diet because I didn't eat meat. I ate tons of dairy and eggs and processed foods, but I didn't eat meat. So he had to change his diet for me. And I accidentally ended up 100% plant-based or vegan, where I wasn't eating any dairy or eggs because he said saturated fat was making me fatter. I was eating tons of, oops, let me get my microphone here. Sorry. I was eating tons of raw vegetables and tons of water and omega-3s and all this stuff. And I'm doing all this and I'm working out. And then a matter of weeks, I noticed I didn't have headaches. I didn't have arthritis. I was working 30-hour shifts as an intern, and I had enough energy to go to the gym after a 30-hour shift. Not normal if you don't have lupus, right? And then when I got my new lab test done, I had a new doctor in California where I was doing my residency, and my labs were negative for lupus for the first time since I was 16, which is not normal. Lupus, I've been in remissions multiple times, but my labs still showed lupus. I still had arthritis. It just was stable, but it was negative. Went back a month later, still negative. And that was 15 years ago. And so it wasn't for a few years that we really understood that it was my diet that changed things. I mean, if diet was important for disease, they probably would have told me that as a doctor. So I never even considered it. Isn't that weird? But it was after I had my first son 5 years later, and I didn't have lupus and it didn't come back. And after having my baby, I was down to my pre-pregnancy weight in 9 days, even though I was just laying on the couch, nursing and eating. That's when we realized that there was something abnormal about my body. My health level was abnormally good. My fitness and metabolism level were abnormally good. And that's when my husband and I put our scientist hats back on and started examining what I did. And the only thing I ever did was really change my diet. And when we went back and researched it on a cellular level, what is it about what I ate and didn't eat that affected my cellular health, my immune system? We figured out that the evidence was there all along that I was on the most anti-inflammatory diet possible. And that's what did it. So that is the shortest version of my story, but that changed everything for me as not only a person who no longer has to live with lupus, but also as a doctor now who is trying to save lives. So I retired from my job as a medical director at a nonprofit. I was treating the homeless, which was my dream to do that. But now my bigger focus is really delivering the information that people need to get their health back. Because it turns out what works for lupus works for rheumatoid arthritis and multiple sclerosis and scleroderma and Sjogren's and mixed connective tissue disease and hypothyroid and hyperthyroid and diabetes and heart disease. You feed the body the right foods, it fixes itself. That's the secret all along. We don't even need these things. You just feed the body the right foods, it fixes itself, then people don't need their meds anymore. And this has been working over and over again. I've been doing this now for a decade with people, and the results are typical and they're consistent and they're powerful. And so that's our mission now. My husband and I work together. And, you know, I always say you got to learn how to save your life. And he says you got to save your wife. But our passion now is giving the gifts we have to everybody else. So that's why I love doing things like this. Anytime I can get the word out there and share this information, then that's what I'm going to do.
That's such a powerful and inspirational story. Each time I hear that, I got chills, seriously. Thank you so much for sharing that. That gives hope to a lot of people. Let me ask you this. What causes autoimmunity in people?
Well, autoimmune disease is all about immune dysfunction, right? So your immune system, the function of your immune system is to maintain the health of your body, right? You have an inflammatory immune system that responds to injuries or to infections, right? If you get a virus, your inflammatory immune system kicks in. If you bang your knee, your inflammatory immune system brings that swelling over to bring all the blood cells in to repair the damage. And then you're also supposed to have an anti-inflammatory immune system. I say supposed to have because the only way to actually develop all the anti-inflammatory immune cells is to eat omega-3 fatty acids, which most people don't eat any of. So most people don't have an active anti-inflammatory immune system. And these keep us in balance. And when we are in balance, we should have inflammation sometimes, be able to release the inflammation, and everything seems to work better. But what we've noticed is that when people get out of balance, when their inflammation levels get too high, where it's not a normal amount, but it becomes an excessive amount, then that affects gene expression. So gene expression, your genes are your kind of deck of cards for the different things that happen to you. So your eye color, your hair color, your height, but also your diseases that you can get, right? In some families, everyone's having heart attacks. Other families, it's diabetes. Other families, it's autoimmune disease. We have all these genes. And these genes can get turned on or turned off, especially the genes for disease. So, you know, for 16 years, I didn't have lupus, and then I did. And then I had it for 12 years, and then I didn't. So gene expression changed, and that affected how my immune system functioned. So right now in Western medicine, it's not really looked at that way. It's looked at as your immune system's not functioning properly. And when your gene expression is affected and your immune system is no longer functioning properly, it's attacking itself, it's doing all the wrong things. What we do in medicine is we just try to suppress the immune system. The problem with that is you need an immune system, right? I remember when I had lupus as a medical student having a sinus infection that lasted 6 months once. Couldn't get rid of it. Right? Because my immune system was not working properly. It was happily attacking my joints, but it wasn't attacking the virus or the bacteria and everything that was attacking me. So we need our immune system to function. And so that's why the Western medical world, it's very difficult. You don't actually address the cause. You just try to suppress the symptoms, which is what we do in everything, right? Your blood pressure's high, take a medicine to bring it down. But what about the cause? Oh, we're not going to fix the cause? Okay, so we'll just keep adding more blood pressure medicines, right? Trying to cut the check engine light and pretend that something's not going on doesn't change the outcome of the person because we didn't fix the cause, right? So I picture modern medicine nowadays as, you know, if you were in a room with the faucet running and it's flooded, doctors are just mopping while we leave the faucet running. That's really how Western medicine works nowadays. Unless it's like an infection, you take something, an antibiotic or an antiviral and the infection goes away, cure. But we don't have cures in other senses because of that problem. We're not addressing the cause. So I see autoimmune diseases really as similarly now, as they're all chronic inflammation caused by an excessive overstimulation of the inflammatory immune system because of excessive ingestion of all the precursors of it, which are inflammatory foods, and then completely ignoring our need to feed our anti-inflammatory immune system. And that's why what I do works so well is when I teach people how to stop eating inflammation and start eating the most anti-inflammatory foods, within weeks, people feel better, sometimes days. And I mean, right now I have a rapid recovery group where I see people every day for 6 weeks and coach them through the changes they need to make in their diet and their lifestyle and make sure that they're doing everything right. We just hit day 21, and out of 30 people, 21 people showed up to the meeting with their symptoms either gone or almost gone in 21 days. And out of the remaining 9, most of those people just aren't posting or participating, or they're not listening yet. Right? But even so, right? It's just normal that when you follow and you do what you're supposed to do, your body just gets better. And some of these people have been sick for decades. So it's very quickly that your body will heal. And that's why I also believe that chronic disease is a construct of the modern world, because it's not normal to get sick and not get better. Right? The example I always give is like, you got a flu when you were 8 and you still have the flu, and you're like, why did I go out with my hair wet when I was 8? I still have the flu. It's 30 years later. It's not normal. But in our world, it's normal to get lupus at 16 and then just have it forever. But it doesn't have to be that way. So that's really how I picture autoimmunity is, you know, that the immune system is not functioning properly because the way we're eating is affecting our gene expression, which is causing our illness to form. But that's something that you can reverse or change. One, through diet. And then the other thing that activates autoimmune disease is any kind of stressor. So your gene expression is affected by what you eat, and your emotion levels, your stress levels, traumas, right? They did a study with people with autoimmune disease in the hospital. 60% of them had a childhood trauma. Enormous amount, right? So when you've had emotional trauma, depression, anxiety, high stress at work, stressful relationships, stress itself is inflammatory, and it adds to that load of inflammation that your body is having to deal with. And that can also trigger or exacerbate autoimmune diseases.
Yeah, so basically what I'm hearing, if, we provide those perfect condition to our body, and since our body has this extraordinary, right, capabilities to heal ourselves, so we can do it in like little time.
Yes. Yeah. And, and it's amazing because it's consistent. Sometimes people who've never seen me online before, who suddenly see one of my videos, they'll get all mad, and they'll say, there's no cure for lupus and it's irresponsible of you to raise people's hopes. And they get all angry. And I always give them a lot of love back because it's terrifying to have autoimmune disease and to, and if all you've ever heard is you have an incurable illness and then you see some perky looking doctor going, oh yeah, you don't have to have that disease. You could be better in a few weeks. I get it. It's aggravating. The cool thing is I don't have to even answer anymore because the answer is like a list of 50 people going, nope, I did the plan and my lupus is gone. My rheumatoid arthritis is gone. My MS is gone. It's like, so I just give them love and validation. I know it's scary. And, that's also why I teach my protocol for free online. I mean, I go online like every 1 to 2 months to teach my entire Goodbye Lupus protocol for free online. It's in my books like Goodbye Lupus, but I teach it for free online. And I do live Q&As as part of why I lose my voice sometimes. Like this week I've taught at least 3 hours of Q&As. I'm going to be teaching another one on Friday. And I do that all for free as a public service. So people can see like this is the information I'm sharing with the world. I have, there's no big kale. There is no big kale, but I was saying there's no big kale paying me to do it. But I want this to just become common knowledge that people can do until it becomes the thing that your rheumatologist prescribes. But we're quite a number of years away from that.
I personally listened to your protocols several years ago, and I healed myself with the help of your protocol and other doctors. But I do drink my green smoothies. That's my green smoothie. So now let's talk about your.
That's fantastic. So how long did it take you? I mean, did you go all in or?
Yeah, as I shared with you, so it took me basically, 3 months to incorporate additional stuff into what I was already doing. Because I mean, I already was raw vegan, but just this final touches, really, helped me.
Yeah, and it's important, right? You have to get all the things right because there's so many ways to do a plant-based diet. There's
Right.
so many ways to do a raw vegan diet. I mean, there's people online eating like 50 bananas a day, right? Like you have to know what the exact ingredients are. And that's where my background really helps because I understand what's happening on a cellular level to be able to say, here's the best way to get those ingredients in. And if you just turn up the volume on those things, the body responds quickly.
Mm-hmm. So let's talk about your hypernourishing protocol for lupus recovery. And my next question is your protocol is just for lupus recovery or for any other chronic illness recovery as well? So.
Right. So as I mentioned before, it's really anything. I mean, this is about feeding your cells the nutrients they use to repair themselves and your immune system what it needs to remove inflammation. That's really what it is. And so if that's the case, it doesn't really matter what illness you have. Lupus is a great place to start because lupus is supposed to be one of the worst autoimmune diseases. And if that can go away, then someone who has arthritis or, Sjogren's, dry eyes, dry mouth, all of those things get better. And I've had people with heart failure who've made full recoveries, diabetes. It really is about feeding yourself the best foods possible. And the cool thing is, even when you've recovered, if you keep eating that way, you just keep being healthier, that you don't get colds much. Or if we have a cold in my house, it lasts 24 hours, where 6 months to heal a sinus infection when I had lupus, 24 hours, I can be out of a cold. I mean, it's amazing what your immune system can do. And then of course it's anti-aging. It's great for your energy. So, I told you today is my birthday. So I'm 43 years old today, feel better than I felt in my 20s. And most people confuse me for being at least 10 years younger, but it's because I'm so well nourished all the time that I can fix up things like skin damage or whatever, that my body can fix all these things because there's no kidneys to heal anymore. So it's something you want to do forever. Even people who are healthy should add these foods to their diet to maintain their health.
Right. So first of all, happy birthday. And you look so vibrant and so beautiful. And I'm so excited to have you here today on your birthday.
So, I know, it's great.
What is the secret of green smoothies? So why green smoothies and why omega-3?
Well, okay. So green smoothies are just an easy way to get all the nutrients in your body needs. So when I first healed, I didn't know about green smoothies. So I was just eating all the food. And I found though, that when I tried to get other people to do it, they weren't as excited about eating like 10 cups of broccoli a day as I was, or, trying to get in drinking down omega-3 oils and stuff like that. Even though it works, people are like, oh, it's hard. It's a lot of chewing, this and that. So about 10 years ago, we came up with this idea of trying to put things into the blender, and we started out making terrible stuff. But we figured out that if you so the highest nutrient foods that you can eat to get all the vitamins and minerals that you need and all the good phytonutrients are going to be dark leafy greens and cruciferous vegetables, cruciferous like kale and cabbage and broccoli and things like that. So if we take a blender, like a Vitamix blender, super powerful, fill it up with like 6 packed cups of greens, like to the 6 cup line, packed tight, right? And then people take either a handful up to half a cup of flax or chia seeds for omega-3s, put in there. Put the water in to the same level of the greens, usually about 40 ounces of water. Then you add fruit for flavor. Fruit's not really gonna help heal you faster, tastes good though. Blend it up. What you get is a green smoothie that has all the nutrition that you really need for your health for the day. Maybe eat a couple more cups of salad or something. But you get your omega-3s, you get most of your greens and hydration, and you just put a straw in it and it tastes like fruit. So, excuse me a second. I told you I beat up my voice a lot. This is the price. You're at the end of the day. But you put that all in and you blend it all up. And then you've got this smoothie that literally people, they don't mind drinking it. They drink it all day long and they get all the nutrition they need, and they don't have to sit there and stare at a bowl of broccoli and feel a tear going down the face, right? That they're able to do it, it tastes good. And that's the most important thing, is that food has to go in. So it's been really effective. And omega-3s, as I said, that's flax seeds, chia seeds, flax oil, chia oil. Those are your anti-inflammatory immune system. When people get high doses of omega-3s in, they get better faster. So it's harder, like you can make chia pudding, you can put flax oil in your dressing, but if you can just shove it all in the blender and just put a straw in it, people get it done. And that's what matters most to me, is it's practical, it's simple, and people do it and they get better.
Have you ever had patients on your rapid recovery protocol who could not tolerate it due to food sensitivities?
No, we can make changes, right? So lots of people have food sensitivity that have autoimmune problems. Their immune system's not working properly. So they're attacking all sorts of random things, even healthy food. So some people, maybe they have a sensitivity to broccoli, or they have a sensitivity to spinach or whatever. We just use the things they're not, there's got to be some high nutrient veggie they can eat. And I've never not found one. Mm-hmm. Find a high nutrient veggie they can eat. We pick which fruits work for them. The fruits don't even matter. It's just whatever flavor they like. Most people can do either flax or chia or the flax oil or something. Like we work until we find a way to make it work. But I've never had it be someone had too many food sensitivities to be able to do hypernourishment.
Okay. Some people worry about traces of cyanide in flax seeds. So could it be a problem for certain people?
No. Listen, as the evidence has become overwhelming that plant-based diets are the only way to really effectively reverse disease. People can have short-term benefits using a lot of things. People can short-term feel better on the most inflammatory diets out there, like the ketogenic diet with meat and everything. Short-term, people can feel better. But when you look at long-term health, nothing is as powerful to reversing disease and optimizing health as a plant-based diet. And at the same time that plant-based diets are gaining momentum and gaining power, all of a sudden there's these random studies that come out, maybe you can have too much spinach and get a stone. 1% of the population or less has an absorption problem for oxalates, but majority of kidney stones come from people who eat too much meat and are dehydrated. But that doesn't make the news, right? Like there's all these things coming out trying to cast shadow of doubt on eating plant foods. So yes, there was a study that said that there's trace amounts of cyanide that can be found in flax seeds. But what they found was, when they really tested it, was in order to even detect even the smallest amount in someone's system, they had to sit down and eat a half a cup of flax by itself. If you mix it with food, it doesn't happen. So by itself, a half a cup of seeds, and you could detect a trace amount in their bloodstream, but there was no negative effect. They had no poisoning, nothing. So So right out there, it's not something to worry about because nobody does that. I don't know anyone who just sits there and does that. I do like people getting a half cup of flax a day, but it's mixed into their smoothie or something. The other thing that's even more important than that study, which is pretty lame in my eyes, is the benefit people get when they do this. So I had people start on a half a cup of flax or chia a day, and then I increase it to whatever their gut will tolerate, because sometimes the seeds bother people's stomach. And what we have found is the more omega-3s people eat, the faster they get better. So if people eat them and their disease goes away, that means more than this study where they were grinding up flax powder and like making people eat cups of flax powder to see what happens. It's just a non-issue when it comes to results. And that's the thing. I'm married to results. That's all I care about. You know, there's theories about everything, and everyone with a mouth has their own theories and their own ideas. And I think it's a disservice to the public for me to just talk about theories. I only teach what works and what works consistently and what works in everybody. If it's something that only works in some people, it's not what I teach. Only what's worked. And over the past decade, I mean, we have thousands of cases of people all over the world with many diseases who can attest to the fact that it works. So yeah, I think if there's no reason to fear flax, but if even that still causes some palpitations of stress or worry in somebody, use chia, no problem, but it's not an issue.
Okay, so, and the next question is very related to this one. Can you obtain all your essential fatty acids from flax? And, you know, for certain people who genetically cannot convert very efficiently omega-3 from flaxseed into DHA and APA, so would you recommend another source of this fatty acids from them, such as, like, for instance, algae, DHA, or APA?
I have not really found that there's people who genetically are not converting it. There's some dogma out there where people will tell you that you can't effectively convert ALA, which is in flax or chia, into EPA and DHA. And that is partially true. So in my free classes, I teach this pathway a lot, that the enzyme that converts ALA into EPA and DHA, which is the omega-3 pathway, the same enzyme also converts arachidonic acid precursors, LA, into the inflammatory immune system, right? So if you're looking just there, the enzyme does prefer the LA pathway, the inflammatory pathway. But so if that's the case, if you're eating, let's say, high amounts of inflammatory foods, meat, dairy, oils, processed foods, and you're getting tons of LA, you're getting tons of inflammatory foods, that enzyme is going to be very busy converting inflammatory immune cells. And if you're just getting a little bit of flax or chia a day, not much conversion is going to happen. However, if you stop eating the inflammatory foods, you cut out meat, dairy, processed foods, oils, that enzyme is now free, and it very effectively converts ALA into the anti-inflammatory immune cells. So I have not seen that be an issue in people. If somebody is not giving up those foods, they either have to super high dose it on ALA, or they're going to have to do something like fish oil or algae oil. But algae oil, even, you know, there's problems with fish oil, you know, between mercury and pollutants, sustainability, ethics, price. But because you have to get like the liquid cold pressed stuff, you can't, the pills don't work. But then algae oil also, to get the dose of omega-3s, I mean, you have to take a whole lot, and most of them are dissolved in like sunflower oil or safflower oil, which are omega-6. So I haven't seen it be effective as a substitution yet, although I would love to see an algae oil company come out with bigger doses, because right now they sell like dropper bottles this big, where my clients would be going through like 4 or 5 of those bottles a week, and they're like $20 a bottle. So flax and chia seeds are super cheap and they work. So the best thing you can do is limit or eliminate the inflammatory foods, and then stick with the flax, chia, flax oil.
Sure. Do you have an explanation of why certain people with autoimmune disease experience a huge relief of their symptoms when they switch to a keto diet? You just, you know, touch base on that. And we all know that a carnivorous diet cannot be healthy, but, you know, how to explain such a phenomenon that it helps people feel a lot of healthier and be able to function normally again when they switch to keto?
Sure. You know, there's lots of steps you can take towards eliminating your pain, your inflammation. And I really see it as a spectrum. So there's the most disease-causing diets, and then there's the most anti-inflammatory, healthiest diets. So any step you take along that spectrum can provide relief. Short term, sometimes even longer than that. It doesn't mean that it's the healthiest thing you can do. It just means it's better than what you were doing. So, for example, there's people who are eating diets really high in processed foods, really high in dairy products, stuff like that. They do a ketogenic diet and they're just eating meat and they've eliminated processed foods. They were doing meat too, but now they're doing, instead of meat and processed foods and tons of dairy, they're doing just the meat. And they feel better. Is it because meat's healthy? No, it's not. Increases your risk of heart disease, cancer. It's clogging up the arteries, right? It's terrible. Causes colon cancer. But they feel better symptomatically. So it's a step, right? But sorry about that. So it's a step in the right direction, but it's not curative. Their disease doesn't go away. And they're creating a lot of risk. I mean, the ketogenic diet is a lot like the original Atkins diet. I call it Atkins 2.0. So Atkins died of a heart attack and he was skinny. Okay, there's lots of ways to be skinny. Chemotherapy worked really well. There's lots of ways to be skinny. Doesn't mean it's good for your health. So then you move away from, so disease-causing diets would be standard American diet and ketogenic diet. Then you move into diets that are less inflammatory. So like the paleo diet. Paleo diet has had a lot of success in helping people feel better. Paleo diet tells you to avoid dairy, avoid processed foods, right? And if people are doing it correctly, which they often don't, you're supposed to eat lots of vegetables, which people often don't do that part. They're just like, oh, meat, lots of meat. So they eat lots of vegetables and a little bit of meat, no processed food, no dairy, step in the right direction. Less inflammatory food, some anti-inflammatory if you're getting vegetables. People feel better. Now, some people can go into remission like that, depending on how much vegetables they eat, but they still have a disease. Way better. Is it an anti-inflammatory diet? No. I have a nurse practitioner who just came to me recently who has been teaching the paleo diet for a decade to her clients and her patients. And she came to me because she had arthritis, autoimmune disease, and she went to the doctor and they showed her there was inflammation in her joints in the MRI, and she said she was offended. How dare you say I have inflammation? I'm on an anti-inflammatory diet. I'm paleo. She said paleo people they're very aggressive, you know, and she admits it. She's like, it's like a cult. It's like, yeah, I'm paleo. I'm anti-inflammatory. So we see inflammation. So now she doesn't know what to do, goes to my classes, watches them angrily, decides to secretly test it, and her joint pain goes away. And she goes, ah, crap. Made an appointment with me. And she's got autoimmune disease in her thyroid. She has Hashimoto. She has antibodies to her thyroid. She's like, I never even thought about that as autoimmune. I said, of course. I said, all that's going to go away now. So paleo is not anti-inflammatory. It's just less inflammatory. And for some people, they feel good. And then you get into even less inflammatory would be a plant-based diet that still had cooked foods. And then what I teach, which is the most anti-inflammatory, which be a plant-based diet that's very high in raw foods, especially the leafy greens, cruciferous vegetables, the omega-3 fatty acids. That's the most anti-inflammatory you can get. So there's a continuum, and that's why people can feel better any step along the way that's better than where they started.
Yeah, yeah. My last question to you. You have published 2 clinical cases describing 2 patients who were able to reverse their chronic kidney disease on your protocol. Mm-hmm. Are you planning to publish any clinical cases of your patients reversing their autoimmune diseases such as rheumatoid arthritis or lupus or anything else?
Yes, yes. So I have that in the works, and I have more cases. It's hard to do the publishing part because anyone who follows me knows I spend all my time either taking care of people or teaching, because this is the fastest route. And the funny thing is, even though the medical world doesn't like to acknowledge case studies and stuff, it's like I spend so much time treating doctors. I just got off the line with a doctor that I'm treating because doctors don't want to take medicine. But it's a slow process. But for example, that took a few months to get written up. And I have another series that I'm looking to publish now that's a combination of lupus and Sjogren's, but people aren't interested. The magazines aren't interested. So that's a harder part, is trying to get that into the world because they're not interested in case studies or they're not interested in nutrition. So it takes a while to get somebody to receive it and to publish it. But I'm working on it. Yes, absolutely.
Okay. Where people can find you, Dr. Goldner, and how you can help people?
Absolutely. So fastest way to find all my stuff would be to go to goodbyelupus.com. Anytime I'm doing free classes, it shows up there. And ways to reach me, all that kind of stuff. If you want free recipes for smoothies, smoothieshred.com, SMOOTHIESHRED. My husband and I share that for free. We share recipes, we share videos. You can join our Facebook community if you want. We do all of that as a public service for people. And then of course, Instagram, Goodbye Lupus, Facebook, Goodbye Lupus, so I'm all over the place. YouTube. Yeah, I'm putting out videos every day trying to help people, so.
Well, thank you so much for being with us today and for sharing your wisdom. And I really deeply appreciate all the work that you do in this world. And thank you so much for taking this stance and educating people on how to prevent and reverse chronic condition. I did it with your help. So thank you so much. Happy birthday. And I also would like to thank our viewers who watch us today. Stay healthy always. I'm your host, Angelina Kardash, and thank you for watching us.